my name is Mia, and for our group, we have me, Araceli, and Fauzia. I personally did depression. I found that for brain structures, it primarily focused on the prefrontal cortex, the amygdala, the hippocampus, and the anterior cingulate cortex. I found that for the prefrontal cortex, it was a lot to do with cognitive control as well as mediating emotional regulation and social behavior. So I said that because difficulty concentration, making decisions, and regulating emotions comes from decreased activity, we should increase both the activity and the volume of the prefrontal cortex. For the amygdala, which is found deep within the temporal lobe and is hyperactive in depression, which causes emotional reactivity, intense feelings of sadness, anxiety, and irritability, we should decrease the size or the activity levels. For the hippocampus, which is vital for memory formation and spatial navigation, I said that we should increase the size because a smaller one leads to memory problems, rumination, and impaired learning. For the anterior cingulate cortex, which is between the frontal lobe and limbic system and integrates information about pain, emotion, and attention, I said that we should improve function smoothness so that it does not cause difficulties in emotional regulation and heightened sensitivity to negative stimuli. There's also the issue of serotonin, which causes mood instability and disrupted sleep patterns, norepinephrine, which causes alertness and stress response, which then turns into fatigue, lack of focus, and blunted emotional reactions, and dopamine, which can cause anhedonia, which is the inability to feel pleasure. We should increase the levels of all three of these neurotransmitters as they affect depression.
Hi, so for my topic, I'm focusing on ADHD and the brain structures involved in its symptoms. So the prefrontal cortex, which handles attention, control, and focus, shows delayed maturation and reduced activity in people with ADHD, leading to difficulties with working memory and impulse control. The thalamus, which filters sensory information, can be smaller or less efficient, causing weaker sensory filtering and increased distractibility. The anterior cingulate cortex helps with attention management, error monitoring, and task switching. So reduced activity here affects the ability to stay focused and shift tasks. Finally, the frontostriatal circuits, which control behavior inhibition, are often underactive, explaining impulsivity and strengthening activity and connectivity in these areas. So through behavioral strategies, skill building, and sometimes medication, it can improve focus, attention, regulation, and self-control.
Hi, my name is Araceli, and I will be talking about how anxiety looks inside the brain. So for starters, you have the amygdala, which processes fears and detects threats and has significant emotional intensity. An overactive amygdala can mean an exaggerated fear response or hypervigilance. And in order to reduce these symptoms, we have to decrease the fear response and hyperarousal by reducing the amygdala reactivity. Things like mindfulness and exposure-based therapy can strengthen the prefrontal inhibition of the amygdala. Now moving on to the prefrontal cortex, which regulates emotional responses and inhibits the amygdala. When there's lower PFC activity, there can be poor emotional regulation, which increases worry and rumination. In order to fix these symptoms within the brain, we have to strengthen the PFC activity, which can lead to better emotional regulation and reduced worry. And cognitive behavior therapy and attention training can improve the PFC amygdala communication. Moving on to anterior cingulate cortex, which monitors conflicts, regulates emotional reactions, and when there's dysfunction within this cortex, there can be a difficulty controlling anxious responses. In order to reduce these symptoms, we can improve ACC connectivity, which can lead to better control over emotional responses. And enhanced activity can mean improved coping and reduced overreaction to stress. And then within the insula, which is involved in interoception, which is awareness of the internal bodily sensations. An overactive insula can mean physical symptoms of anxiety like heart racing and GI issues. And in order to relieve these symptoms, we can have training and interoceptive awareness, which helps reduce body symptom triggered anxiety. And also increasing regulation can mean fewer panic-like physical symptoms. And now our ultimate brain model is basically just activity and connection in the frontal cortex, which can mean better focus, planning, and emotional control. And there's also a stronger amygdala, which can focus on regulation of attention and emotion and better tasks, switching, and less rumination and worry. And then increasing the thalamus efficiency can mean being less distracted, which can also help with the symptoms of ADHD. And yeah, thank you.